Hello everybody, I am Dr. Sahebaan Sethi, glaucoma consultant at Gurugram. I am going to today talk about the very important topic of when is the right time to undergo surgery for glaucoma. Now you may be a glaucoma patient putting anti-glaucoma medications for a long period of time, or your doctor may have advised you glaucoma surgery, but you may be confused about is it the right time for me to undergo surgery? Well, see, glaucoma is a very vast topic, but let me try and break it down to as simple terms as possible. So let's start with a little basics before we go into this topic in a little more detail. Now, glaucoma is of various types. There are two basic genetic types of glaucoma. One is the closed angle and one is the open angle glaucoma. This is the closed angle and an open angle glaucoma. Now what this broadly means is that in a closed angle glaucoma, the drainage system of the eye is occluded, and so the water inside the eye cannot drain, gets accumulated inside the eye, causes a high eye pressure and compresses the optic nerve, which leads to glaucoma and diminution of vision, which is irreversible. Now, in an open angle glaucoma, your drainage system may be open, but it is dysfunctional, leading to the same series of events, causing the optic nerve to get damaged. So now, if you have an angle closure sort of glaucoma and your diagnosis has just been made, what do? So at the time of diagnosis, in an angle closure glaucoma, you initially need to open up the angle, right? You need to treat the problem. So you have to, right at the time of diagnosis, go for something called YAG-PI, which means YAG peripheral iridotomy. Now this is a kind of laser which is done in the OPD to open up the occluded angle and hence cause the problem to go away. Now if at the time of diagnosis, however, you have also been told that you have cataract, in that scenario it's better to directly go for a cataract surgery. So if you have a cataract at the time of diagnosis of a closed angle, you go for straight away cataract surgery. Now this will save you the effort of undergoing a laser and thereafter cataract surgery maybe in a few months or a few years. And the cataract surgery will also function as opening up the angles and does the same thing that the YAG-PI does. But at the same time, if you have a clear lens, if there is absolutely no evidence cataract, your vision is perfect at the time of diagnosis, then it's better to opt for YAG peripheral iridotomy. Then let's look at the open angle variety. So if you have an open angle glaucoma, the first thing you need to ask your doctor is, what is your stage of glaucoma? Is it mild? Is it moderate? Or is it severe? So every glaucoma diagnosis is made by doing a visual field test, which looks something like this. This is a printout of 3 single visual fields, broadly to show you how a mild, moderate and severe visual fields should look like. So in a mild visual field, over here we are only going to concentrate on this gray scale, which is basically a scale that we use to explain to patients how severe your disease is. Now, if in this gray scale you see few black spots, which means that this is your entire 30 degrees of visual field, the point at the intersection is at the center is the center of your vision. Now over here you see that there are some black spots, which means that the inferior part of your visual field is starting to get affected. But still it is a mild disease because fairly for the large part of the gray scale, the black dots have not shown. So the vision is only defective here. So this is a mild stage of glaucoma broadly. So this basically requires an expert to read the visual field. So it will not be possible for a patient to ascertain what stage of glaucoma they are in. But this is definitely a discussion that you can have with your doctor and he will explain to you better. He or she will explain to you better. Now this is a kind of visual fields which belongs to a moderate stage of glaucoma, which means that the black spots are a little more than the first one, and this is a severe visual field loss, which means most of the visual field of the patient is black. So to break it down simply, I would say this is a normal visual field And then as and how the black spots increase in intensity and number, your visual fields are getting more and more severe. Okay. So if you have a mild glaucoma at the time of diagnosis and you do not have any cataract, in this case, you are just going to go in for topical anti-glaucoma medications. Now, how many medications or how many eye drops your doctor gives you is very individualized and it cannot be generalized. It depends on a lot of other factors that your doctor will have to consider before giving you a certain number of anti-glaucoma medications to control your eye pressure. Now, how much should the eye pressure be? Now, in a mild stage of glaucoma, we are happy if your eye pressure is below 18 millimeters of mercury. Now, this is again a very broad figure, and like I said, glaucoma is a very individual disease. Each and every patient is unique. The target pressure for each and every patient will also be decided only by your glaucoma specialist. Now, in a moderate stage of glaucoma, we are happy if the eye pressure is less than 15 millimeters of mercury, and in a severe case of glaucoma, we need to keep the eye pressure less than 10 to 12 millimeters of mercury. Coming back, if you have a mild stage of glaucoma without cataract, you can probably do with just topical anti-glaucoma medications. But if you have a mild glaucoma with cataract, in that case, you want to go in for a cataract surgery along with MIGS. Now, MIGS is basically a minimally invasive glaucoma surgery, which basically means that it has a great safety profile. It is very less invasive. The recovery period is fast. The visual rehabilitation is great. And it takes about only 10 to 15 minutes more over and above your cataract surgery to do it at the same sitting, so that you don't need multiple surgeries for cataract and different one for glaucoma. And it addresses the problem of high eye pressure or the dysfunctional drainage system. Now, the MIGS in this category that I would suggest if your glaucoma is mild is eye stent. You can see my other videos on to understand a little more about minimally invasive glaucoma surgery, what are the different options. Now, if you have a moderate stage of glaucoma without cataract, I think you will do well with anti-glaucoma medications. However, if it is uncontrolled, if your eye pressure is uncontrolled with anti-glaucoma medications, you can think of MIGS. Now, in this case, the MIGS will be a standalone MIGS. If you have a clear lens, your minimally invasive glaucoma surgery will be just done without the cataract surgery. If you already have had your cataract removed, still your MIGS can be done as a standalone procedure. But if you have cataract, naturally, the option is cataract surgery with MIGS. Now, the MIGS that I would like to prefer in a moderate stage of glaucoma is either Kahook dual blade or an eye stent may also fairly work well. Now, if you have been diagnosed as a severe case of glaucoma, in that case, again, we need to consider whether you have cataract or you don't. With cataract and without cataract. So with cataract, the option is very, very straightforward. You need to go in for a cataract surgery along with a procedure called trabeculectomy. Now, trabeculectomy is a conventional glaucoma surgery that we have been doing for many, many decades now. However, it is a little more invasive than minimally invasive glaucoma surgery, but even having said that, in a severe stage of glaucoma, there is no option of doing minimally invasive glaucoma surgery and you have to resort to trab, which means that you will have stitches in your eye. It'll be a little more aggressive than MIGS. You will also need local anesthesia for doing it in the form of injection. Now, if you do not have cataract and you have severe glaucoma, we do try and control it with anti-glaucoma medications. However, if an eye pressure of 10 to 12 is not achieved, in this case, you can go in for a plain trabeculectomy, whether you have clear lens or even if you've had a cataract surgery done and the IOL is already in place, you can have a standalone trabeculectomy done. Now let's remember that these are all options for primary glaucomas. There is also an entity called secondary glaucoma, which means that it is not a genetic form of glaucoma, but it has been caused by certain factors or certain diseases in the eye. Commonly, we have conditions like steroid use can cause glaucoma, any diabetes or bleeding in the retina because of diabetes, hypertension can cause glaucoma, multiple episodes of uveitis can cause glaucoma, trauma to the eye can cause glaucoma. So in all these cases, even in secondary glaucomas, we have an option of trab or we have the option of tube. So tube basically means that there is a valve implant which is placed inside the eye that drains the fluid out. It's like a pipe that goes from inside to outside the eye through which the water is drained out. At the end of this video, I also want to send out the message that all of this information is only for educational purposes and you cannot treat yourself based on this information. Again, I would like to reiterate that glaucoma is a very unique disease. Each patient has his own problems, has his own stages, has his own treatment plan, and that can only be best decided by your glaucoma specialist. Thank you for watching.